Uh, this is a webinar on biological disaster management post-COVID-19, and it is an initiative of Manav Rachna Center for Peace and Sustainability, which is a center of excellence of our university. I, on my personal behalf and on behalf of Manav Rachna Center for Peace and Sustainability, welcome all our esteemed guests, especially the distinguished speaker, Dr. Muzaffar Ahmed, an authority in disaster management, and all the participants across the globe to this webinar on biological disaster management post-COVID-19. The Center for Peace works basically to provide education and training to maintain peace and sustainability on globe. It also inculcates values of peace and sustainability, which are very essential, especially during these crises which we are facing these days. It also helps us in promoting research, in working in various areas, especially health and well-being of all, and helps in policy framing at the national level so that we are in a position to contribute to the society. The Manav Rachna educational institutions, in fact, we have two universities, deemed university and one state university, and we have several schools which are run under this name, Manav Rachna. Professor Sanjay Srivastava, who is one of the panelists, looks after Manav Rachna Institute, International Institute of Research and Studies, and it is a deemed university, and I look after the state private university, which is known as Manav Rachna University. All the programs in these universities, in fact, are approved by the respective councils, in fact, be it technical courses or BCI, NCT, DCI, all these courses are approved by the respective regulating bodies. The state university has been recently certified as QS Gold rating as well as E-Lead rating recently, in fact. Our universities have an ecosystem of innovation and research. And recently, one of our incubation and innovation centers has been ranked with 4-star rating of MHRD IICT cell. The students working in these IICs participate in international and national competitions. The center helps and supports in entrepreneurship thinking as well. The Government of India has also the MOOCs platform, SWAYAM, and we are recognized as the most valuable local chapter in Delhi with rating of A, in fact. And we promote our students to use maximum number of courses of NPTEL, Coursera, EDX, and other reputed platforms. We have implemented complete choice-based credit system in our university, and the concept of minor and honors degree is provided there. The students are encouraged to take courses across the disciplines, in fact. The Manav Rachna also promotes quality research and the professional development by providing various seed money and other supporting things. It also keeps pace with the latest global trends and upgrades the curriculum to keep it recent and relevant. Courses like artificial intelligence, machine learning, data analytics, blockchains, mechatronics, robotics, nanotechnology, all these courses are embedded in all the courses across all disciplines, in fact, and we impart skill set which is required in 21st century learning, like creativity, problem solving, and many other life skills which are very, very important. We have quite good understanding with the industry, and we understand what is the current need of the industry, and therefore we collaborate with industry in designing and delivering various courses. Uh, uh, Various industries like IBM, Altair, Xebia, Quickheal, Design Tech. These are some of the Mitsubishi, AWS, to name a few, are some of the partners who help us in designing and also delivering jointly these courses. And this helps us also in promoting innovation and incubation, which is the requirement of the industry. They also provide a lot of support in terms of the projects and problem statements. And our focus is that our faculty should be trained in the latest pedagogy so that they are picking up courses which are need of the hour, and the project-based learning, collaborative learning is what we talk about, which is being practiced in all our courses. We have the internal audit system in place, and internal audit is being done to our processes over a period of time. Our significant aspect of education is that we do have research carried out at undergraduate level through research clusters, centers of excellences, and this has proved to be very beneficial for the students also. And in this COVID-19 outbreak, in fact, Manav Rachna University, as well as the other university, MRRS, were the first universities in the country. We shifted immediately to the learning management system, and we have not even wasted even a single day in delivering to our students. Our coming back to this biological disasters, in fact, this seems to be now a very important topic, and all of us need to understand it. Our expert today will be talking about the biological disasters, which do affect in an enormous manner because they spread across the globe, and this COVID has the way it has spread, it has affected thousands and thousands of lakhs and lakhs of people, and it has created loss of life, injury, illness, not only the physical illness, even the mental illness, property damages, loss of livelihood, social and economical disruptions have taken place. Besides, it has also also had effect on the environmental sustainability, that how do we sustain ourselves. We had seen earlier a lot of biological disasters which were in the form of malaria, dengue, bird flu, swine flu, but this has surpassed, in fact, every aspect of it, and therefore we do need to understand how this prevention can be done before it spreads, and also after now it has spread, and what needs to be done. It is in terms of whether the engineering controls need to be done, whether the personal hygiene has to be taken care of, or the personal protection things like sterilization and respiratory protection. All these things need to be understood, in fact, and they need to be recognized, communicated to people. Also, we also need to be very critical about the public health measures which need to be taken. And this has taken us for surprise. We had just one lab in the country to look after to see whether the virus exists or not. Now today we have more than 300 laboratories. But I think somewhere we had missed this aspect, that in case such things happen, how do we take care of this at the national level? There must be an institutional framework, some operational framework. We should take care of it. I'll just conclude by with the remark that biological hazards can kill, or they may cause discomfort and affect the health and performance of employees and general public at the very least. Therefore, we have to be vigilant in preventing and controlling biological hazards to make the environment a safer and a healthier place. Now, with these remarks, may I now request our Prashant Balaji, who is the Chancellor of our university, who is Chancellor of Manav Rachna University. He is President of the Chancellor of Manav Rachna in IIRS also. He is President of Manav Rachna Educational Institution. He is President of Manav Rachna International Schools. He is Treasurer of Educational Promotional Society of India. He is member of CII. He is president of Faridabad Now Chetna Trust and Dr. O.P. Bala Foundation. He is also chairman of the National Council on Education of SOCHM India. I just request Dr. Prashant ji to formally welcome Dr. Muzaffar Ahmed, who is the expert today, and say a few words.
Thank you, Professor Bhatt. It's indeed an honor and privilege to welcome Professor Dr. Muzaffar Ahmed, who's a former member, National Disaster Management Authority and National Advisor, UNICEF. He's member, Strategic Advisory Board, Millennium Alliance. Thank you, sir, for accepting our invitation and being here today. Professor Ahmed is a postgraduate medical expert with more than 28 years experience, having worked in various positions in this field of health and medical education and disaster management, National Health Mission, mass casualty management during emergencies and disasters. He is chairman of Task Force, Ministry of Health and Family Welfare, Government of India on training of doctors and other professionals. Professor Ahmed is recipient of many prestigious awards in the field of medical sciences, public health. He received Dr. B.C. Roy National Award by President of India in July 2008 for his contribution in medical services. Prakriti has various manifestations, and sometimes it is so calm, while other times it becomes fierce. And the calm side is obviously loved by each one of us. And as Professor Bhatt was also mentioning, that disasters just occur, and I think of this magnitude that we are seeing today, and we see the ferocious side of it. In wake of current scenario, I think COVID-19 is indeed a wake-up call for a human race. And today, when we are dealing with this COVID-19, everyone is discussing about such pandemics that happened in the past and had the long-lasting impacts on the human civilization. COVID-19 is only the one of many global hazards that has threatened human existence on this planet, and first of its kind experience to almost all of us. We at Manav Rachna, sir, understand our responsibility for the society and are proactively engaged in various activities under the Dr. O.P. Bhalla Foundation, like organizing blood donation camps, plantation drives, feed the hunger through Ek Muthi Daan, collecting funds for National Relief Fund during this natural disaster. Even we have been regularly supplying dry ration to 1,000 families every week. We started with a teacher on call project for government schools and a project Sathi to counsel the persons staying alone and feeling depressed. The Center for Peace and Sustainability under Manav Rachna University also is one such attempt to contribute towards well-being of our ecosystem. I thank our expert, Professor Ahmed, for being here, and today I would request him to guide us how educational institutions like ours can contribute and educate the students to combat these situations. Thanks for being here, sir. Over to you. Thank you.
Respected Dr. Prashant Balaji, Chancellor, Manav Rachna University, Dr. Amit Balaji, Dr. Sanjay Srivastav ji, Dr. I.K. Bhatt ji, other distinguished faculty members of the university and participants. Let me first thank Manav Rachna University to have given me a chance to speak on this subject, which is very relevant and important for all of us. And I thought, while I'll be speaking on biological disasters and post-COVID, what is required to be done, and especially what will be the priorities of action, I thought in my presentation, let me also speak what are our disaster management scenario in India, and also what are the international regulations and international commitments of which India is also signatory. So let me start, sir.
इसको full presentation mode में डाल दीजिएगा.
Am I visible, sir?
This
Is the presentation?
Yes, sir. Yes, yes. It's visible.
Have you been able to?
Yes,
Sorry,
yes,
sir. Okay, sir. So I'll be talking on biological disasters and post-COVID action, what is required to be done. Let me tell you the definitions of disasters, which has been defined by many organizations, and the World Health Organization has described it as any occurrence that causes damage, ecological disruption, loss of human life, or deterioration of health and health services on a scale sufficient warrant an extraordinary response, and also in the community. And if we talk on the about the emergencies can be quickly, I'll mention natural, man-made, and
आपका ये साउंड कम हो गया. म्यूट हो गया शायद.
आवाज एकदम नहीं आ रही है.
आपकी आवाज आपका म्यूट हो गया शायद.
भट्ट साहब फोन कर दें उन्हें. भट्ट साहब फोन कर दें, आप फोन कर दें मुजफ्फर साहब को.
and the duration and the example of these events can generate. जी,
आपका वो शायद म्यूट हुआ था.
hello,
तो
am I?
नहीं, you are not audible.
Now you are audible. Now you carry on, sir. Previously it was some problem. No, sir. You're not audible. There's some problem with the sound.
Of the affected society to cope up with the circumstances. And if we see over the years, the damages for this is the data for 10 years, where there has been the damages of more than 1.4 trillion US dollars, and 1.7 billion people have been affected from disasters, and 0.7 million almost people have died over the 10 past years due to various disasters. And if we talk about our country, we have in the 10 years period, which was a study was done, presented in the UN, India ranks at number 2 after China. And even if we take the people killed, we are at position number 5 globally, and damages again at position number 5. The famous British risk assessor Maplecraft has said India, along with 6 countries, Mexico, Philippines, Turkey, Indonesia, and Italy, are rated high risk in absolute terms. And World Bank report says India we lose 10-12% of the central government revenue due to disasters. I need not to mention, people must know that more than 50% of our land loss is prone to earthquakes. We are prone to drought. floods, erosions, and we have seen over the last 20 years large number of even earthquakes leading to 35,000 deaths, which have occurred in zone 4, seismic zone 4 and 5, in addition to the accidents, building collapse, sabotage, tsunami, cyclones, and epidemics. The environment and climate change again has put our country to challenges of hailstorms, cloudbursts, snow avalanches, floods, dam bursts, cold wave, extreme weather events, heat wave, and unprecedented drought. And when we talk about multi-hazard, hardly there is any state left in our country which is not vulnerable to one or other disasters. And if we talk about the major man-made disasters, chemical, biological, radiological, transport, urban flooding, right, and technological disasters are listed. And we should also know about the accidents. India has a large network of railways for which we also face the accidents, railway accidents, and because of our urban growth, which is a lot of urbanization, and it is expected that by 2026, India will reach almost 534 millions in urban areas, and our cities are going to be at risk, not only for urban flooding, but also chemical and biological, which we are now seeing in Dharavi, in Delhi slum areas, which is going to be a big challenge, and also inadequate regulations and enforcement of the building environment is a big challenge for us, all of us. Another problem which we are facing is about the road traffic accidents in India. Every minute we have a road traffic accident, and every 3 to 4 minutes we lose a life, and we lose almost 3% of GDP to road accidents. The capacity in various areas of our country has been low, and we have to do some to find out the solutions, what we have seen now. And previously, whenever a disaster or emergency would occur, the only thing what the government was used to do was providing relief. But this approach was changed with the enactment of the National Disaster Management Act, where there was a paradigm shift from reactive and relief-centric approach to holistic, integrated approach on prevention, mitigation, and preparedness. And the definition of disaster was given by our parliament, which also included degradation of environment and coping capacity of the community of the affected area. This definition of the disaster by the parliament in the act has covered almost all the disasters, including the climate and environmental change. This act, the National Disaster Management Act, which you now read and listen, being used by all the functionaries, has given us a vision to build safe and disaster resilient India by developing holistic, proactive, multi-disaster, technology-driven approach for prevention, mitigation, preparedness, and efficient response. There is a strategy not only for prevention, but also for preparedness, capacity building, community-based disaster management. And we have a policy, which is a National Disaster Management Policy, which was approved by the government, that is to build a safe and disaster resilient India. And with the approach, we have a structure right at the national level, which is the apex body at NDMA, headed by the Prime Minister, at state level by the Chief Minister, at the district level by the district executive committee under the Act, where secretaries of 14 ministries and chief of the integrated defense staff functions as the executive committee of NDMA. And this is the committee which has been taking decisions with regard to whether lockdown, easing, issuing various guidelines, various SOPs from time to time in the present. This legal institutional framework in India has been a unique, because this has helped in country in building not only the capacity and competence at the national level, but even at the panchayat and municipality level, which has been a rather a good thing for us, our country. Various ministries have been given responsibilities, and if we talk about the epidemics and biological disasters, this is the responsibility lies with the Ministry of Health, being the nodal ministry. We have a specialized National Disaster Response Force battalion spread all over the country, which is a multi-skilled force capable of responding to biological and chemical emergencies. They are trained, equipped as per the international standards, and they are dedicated exclusively for disaster response. Whenever a disaster or emergency occurs, besides search and rescue first aid, we need to provide minimum standards for relief. Disposal of the dead bodies is a very important. Besides, how do we prevent epidemics and control epidemics? And what the main problem in this epidemics and disasters is problem usually occurs in hospitals, and the management system of the hospitals, they cannot effectively meet the additional needs due to either lack of clearly defined leadership, chain of command, or lack of accurate facts and information, miscommunication, which is a very important thing. Let me talk to you about the international framework for emergencies, which what we call as a Sunday framework. This Sunday framework was signed, where our country is also signatory, on 15th of March in 2015, where 15 years roadmap has been prepared with the idea to reduce the disaster risk and loss of lives, livelihoods, and health and economic, physical and social, cultural, environmental assets. This framework has 7 global targets and priorities. The 4 priorities are that we should be able to understand the risk, we should strengthen disaster risk governance, we should invest in the disaster, what our country is doing, and we should also enhance our preparedness. And the 7 global targets, besides the reducing the disaster mortality by 2030, number of people affected have to be reduced. Direct disaster economic losses is a major concern, which has also occurred during this COVID pandemic. And important thing is that we should be able to substantially reduce disaster risk damage to our critical infrastructure, which includes educational institutions, health facilities by 2030. These strategies and these targets are very important, and we also need to have a ability of and access to multi-hazard early warning systems and disaster risk information. The idea is that we should become resilient and sustainable by 2030, which is an important goal. And if we talk about our SDG goals, SDG goal 3 shares that we should ensure healthy lives and promote well-being of all ages. And also we should make our cities and human settlements inclusive, safe, resilient, and sustainable, which is important even in this coronavirus pandemic. And there are various things, whether it's the treatment of obstetric emergencies, treatment of, there are these goals. And again, this says that we should be able to reduce number of deaths to the people due to disasters, and we should also make our resilient health system in our country. And biological disasters, which can be natural, they can be accidental, or they can be intentional, what we call as a biological threat, which has been having made a lasting impact on civilization. biological disasters might be caused by epidemics, which we are seeing, or it can be accidental release of virulent microorganisms. There is a lot of discussion going on whether the present is a release from laboratory or with the use of biological agents, some like anthrax, smallpox, and such other viruses. And if we talk about these biological agents, they are unrecognized, they are undetectable by human sense, they have some have long prolonged incubation period, and the route of transmission can be, they can be absorbed through skin, mucous membrane, they can be inhaled respiratory through air droplets, what is now in the present pandemic, or they can even be injected or even ingested. And even when we talk about these biological agents, there are some vectors which carry these from one place to other, like letters, packages, some where animals are the main vectors, insects, contaminated food. Clothing is also an important vector which can cause dissemination of these. And if we talk about the classification of these biological agents, the Center for Disease, Communicable Disease Center, Atlanta, CDC, Atlanta has divided this into category A, B, and C. Category A is which causes very high mortality with potential for major public health impact. And there are some examples of these. And category B, it causes moderate morbidity and it has comparatively low mortality. And again, the category C, it may have the potential of high morbidity, mortality, and health impact, which even has been seen in the multi-drug resistant tuberculosis in the present times. And they have also categorized, which I, because of the paucity of time, I will not go in the detail. The category A, which have high mortality, some have category B medium, and category C, which I have mentioned. And what these bioagents, they cause disease and death by inhalation, which is very important. And even the symptoms may be delayed. People may remain asymptomatic for a long time, and there may be no vaccine. What we are seeing in the present circumstances, there is no vaccine, and some survive dormant in the environment for weeks or to years, which some of the viruses may remain even for years, for which we have to be prepared. And there are the agents, it may be bacterial, it may be viral, and even what we call is a biotoxins. And some of the examples are bacteria and viruses, hemorrhagic Lassa fever, Ebola, Middle East respiratory virus. And if we talk about how can we find whether a biological attack or an epidemic has occurred, there is a large unexplained epidemic with similar acute large number of patients coming, multiple diseases in same patient, unusual genetic and molecular patterns, and even epidemiological clues, what we say, a greater case load than expected of a specific disease. Disease occurs outside the normal transmission season. Disease outbreak in humans after recognition of disease in animals. And even in some areas, we may find some unexplained number of dead animals which can give clues. There are again medical clues which can give about the uncommon, about the the severe disease symptoms, high fatality rate suddenly occurring, unusual age distribution of clinical presentation. And again, there are some mysterious clues sometimes about the biological, the intelligence, our intelligence agencies give the reports that they have a feedback of a epidemic biothreat, which is also to be taken into account. And also, if increased number of antibiotics in pharmacy or drugs, or increased number of emergency calls or admission occurs in hospitals can give you a clue. And delivery is very important. It can be through, if you want to have bioagents, even they can be used in the aircrafts, for which we have to be very cautious what we are being doing now in the air travel. It can be sprayed through our HVAC, through our ventilation system, air conditioning, or they can be spread through vehicles which we have mentioned. And it is very important to note that a tiny amount of bioagent can be very potent, and inhalation of even 400 millions of virus they fit on a pinhead. You can yourself see the number of virus. They're so small, and inhalation of even very small matter can lead to sickness, even the biotoxins, which are very important to understand. And the detection of these bioagents, they cannot be seen, they cannot be heard, they cannot be smelled. They can only be detected in the laboratories, for which our laboratories have to be fully equipped, and our laboratory has to have a good biosafety level. And if our laboratories are good, with good safety level, we'll be able to diagnose. And we also talk about the biological biowarfare agents and toxins, which can be human pathogens, it can be animal pathogens, even it can be plant pathogens, it can be food and waterborne pathogens, which also create problems from time to time. If we talk about the epidemics, they can result in heavy mortalities and lead to depletion of the population with a drop in economic activity, which we have seen whether it was in Spanish influenza or in some countries when the HIV epidemic occurred in African countries. So these pandemics have occurred. We have the historical record. They have occurred from time to time because of increasing emergence of viral diseases, especially zoonotic diseases from animals. And if we talk, the influenza is the most likely pathogen which has caused severe pandemic in a given year, and even it leads to more than 6 million cases of pneumonia and influenza globally. Almost this has occurred over the years. And these pandemics have significant social and economic cost to humanity over centuries. If we talk about the historical background, what occurred in 165 AD in Athens, or which was considered that times typhus and typhoid in Egypt, in other countries from time to time. And it all depends a country's expected ability to curtail pandemic spread, and it depends on how much country is prepared to take care, and whether the public health infrastructure is capable of identifying, tracing, and managing and treating these cases, and whether there is capacity to mobilize financial resources to pay for disease response, and whether the economic shock of the outbreak can be met, which is very important. There has been knowledge gap, and this gap has been because there is no widely accepted consistent methodology for estimating the economic impact of pandemics, for which the time has come. Our universities, our research scholars in our countries can play an important role to see. And also it has been seen the availability of healthcare workers also decreased during the pandemics, not only because they become ill, there have been deaths in the health workers, which even in the present pandemic, and also because of the fear-driven there has been absenteeism in many countries, and it has been seen, whether it was seen in African countries, in Congo, it was seen during Ebola crisis, it was seen even in number of other West African Ebola epidemic scene. And some events experience, if we see our past events, the Surat, we had one of the biological emergency which occurred, plague in Surat. It led to disrupted economic activities, industry, generated exodus, and even had a massive economic fallout in the past. And the coping, if we have to cope up with the pandemic in a large scale, it presents additional challenges, close living, especially in slums, crowded places, where it is a big challenge and problem, like what we have been facing in Maharashtra and even in Delhi, in Dharavi and some slum areas. The potential tidal wave of all ill persons seeking care may overwhelm already overcrowded our fragile healthcare delivery system in many cities, not only in our country, but it can happen in any countries. I need not to give the definition. You can read that there are some definition, whether how do we take what is the biorisk management. It's the analysis and ways of development of what strategies to minimize the likelihood of occurrence. Biosafety is how do we take care of technologies which can be safety of our laboratory, and even the biosecurity is how do we take care of our microbial agents, viruses, so that they don't leak out. And bioterrorism is the intentional use of these microorganisms, viruses. And chemoprophylaxis is administration of chemicals, including antibiotics, to prevent the development of an infection. Then there is about the bioweapons. Even these biological agents are used in the weapon heads. And these usually, droplet infection is, what is the droplet infection? Even 0.1 millimeter in diameter evaporates immediately to become a minute particle. And it is the droplet infection in the area of whenever there's outbreak or an epidemic which creates problem. And let me tell you, epidemics do not respect national borders. International travel has become very easy. Biological agents need to be tracked so that they don't enter any regions across the boundaries. And for this, international organizations like WHO has made, and along with the FAO, international health regulations, which is that these diseases should not move from one country to other, because the rapid access to large population, we have the poor global security, which creates problem. Large number of people travel from one country to other, which has created large number of mortalities. And in the present crisis, pandemics are usually large outbreaks of infectious diseases that can greatly increase morbidity and mortality. So we need to ensure that if these IHR regulations are met seriously by countries where they find the cases, we can save these infections to travel from one place to other. About the coronavirus, the first case was reported on 17th November in Hubei province, and it went unrecognized. Although it was published in one of the journal, and international travel is believed to have taken the infection around the globe to such a scale that by March 2020, it reached almost globally all over the world. And in early December, the World Health Organization identified it as a SARS-CoV-2 coronavirus. And this COVID-19 pandemic, it's not only straining the health systems worldwide, but the rapidly increasing demand on health facilities, workers, and even the administration has created a lot of problems all over the world. Governments globally have reacted differently to this pandemic. On an extreme, if you see Sweden, while the people they were advised to follow social distancing and other precautions, but there was no lockdown. But India, in our India, lockdown was there, and this, in fact, I would say that the COVID-19 infection has exposed the so-called, even the most developed countries like America, systems to the maximum, from logistics of essential commodities to healthcare facilities. Everything was strained in alarming situation. If we see what happened in New York, what happened in Brazil, even what happened in Italy and Spain, some countries where the health systems are far better than our health systems. And the pandemic occurred all over the world, and WHO declared the novel coronavirus a pandemic. And why we call it, I need not to go, the acronym is that the World Health Organization stands for, it's a COVID is a coronavirus disease. They named it coronavirus disease 2019. Basically, it's a SARS-CoV-2. And why we call it a novel is because the strain is new. It has not been detected in humans so far. And this coronavirus is common virus which not only affects the sinuses, but even the respiratory system, all other systems of the body, and can be dangerous. And the contact is person to person, and it can be mild to deadly from person to person. And in the Chinese, they found that there are two strains. One is the L and S strain, which have been seen in the later stage of the outbreak when they do studies. And if we talk about the symptoms, I need not to quickly, I will mention not only the cough, fever, shortness of breath, there's a fatigue, body aches, headache, sore throat, nausea, and even diarrhea. And in most symptoms, fever is in 99% of the cases, fatigue 70% of the cases, cough almost 59%, loss of appetite 40%, body aches 35%, and shortness of breath 31%. And even the virus can lead to septic shock and death, which is to be prevented in the isolation hospitals. There are some of the risk factors which are very important, especially in children, young adults, and also in the people, elderly people who have high blood pressure, who have heart diseases, who have lung diseases, who have asthma, kidney diseases, diabetes, the people who are on cancer treatment, liver diseases, and even it has been seen to have in the people who have cigarette smokers. And the transmission occurs, what I would say, that from person to person, and even we can get the virus by touching a surface, and this virus remains on the surface of copper for 4 hours, cardboard for 24 hours, and it remains on plastic and steel for more than 2 to 3 days. That's why it is important to take care for spread of this and to spread it in the community. And how do we take the precautions? And prevention is the important is first is not only the washing your hands with soap and water, alcohol-based sanitizer, but important is practicing social distancing, cover your nose and mouth in public, and also if anyone has the symptoms, they should seek medical advice. And besides, don't touch your eyes, don't touch your face, and see your surroundings are clean and disinfectant, and we can only stop the spread of this coronavirus from person to person if we look into the people, do the testing, find the people positive and negative. If we have positive, we have to isolate him. We have to trace his contacts, do the quarantine, which is very important to do it. And if we talk about what has been our India's response to COVID pandemic has been very good, which was described in the Oxford COVID, a survey that India scored almost 100 points along with other countries, New Zealand, Mauritius, South Africa, Israel. This is very important. And the Indian government quickly reacted, not only screening of air travelers coming right in the month of January, but even when a person reported with no symptoms, the government machinery was activated to do the testing. And if the person was positive, track their contacts, quarantine them, and so that they don't spread the infection. And also India earmarked to ensure that most of the stranded citizens, especially workers and students stuck abroad in various countries, were flown back in phases, which was very important to do it. Our journey started defeating as early as January 8th with complete lockdown, what we call a Janta curfew, which has been very important. This has not only created community awareness, but has also led to positive impact in the long term. And what has been that we have been able to strengthen our healthcare institutions in a big way. Unfortunately, there have been gaps in the care of the patients of other ailments, as the priority was given to the patients of COVID. The patients who were either who had to be dialysis, or who had to be given chemotherapy, they suffered. That's to some, in some places, hospitals, they suffered, which was an area of concern. So what was this lockdown gave us important was strengthening of our government infrastructure and private public partnership, which is a very important thing. And also our and the problem in our country was because of the low expenditure, 1.4% of GDP of public health expenditure in the healthcare. But now, recognizing the need for strengthening and making the health system resilient, the government of India is going to spend 2.5% of the GDP in the coming years. And what is important is also our pharma chain and make in India focus for our medical equipment. You know, the shortage of ventilators, shortage of personal protection equipment, masks was a big issue. But we came to this challenge, and now ventilators within a short, which used to be imported from countries, have now been manufactured, are being manufactured by various startups, by various agencies, because we have a strong pharma industries. We export large number of medicines to other countries, like you might have heard about hydroxychloroquine to various countries. And that's why we have to, but we also have to ensure that we don't rely on the import of bulk drugs from China. We have to find out ways how do we improve our bulk drug manufacturing, as we were relying on China for bulk drugs. And another thing was over resilient on China in medical equipment. Almost all equipments throughout the world, where majority of the equipments were being given by China, but now we have made a way for making the future, not only the personal protection equipments which are now being manufactured in large number, but even the ventilators. Again, another thing, large number of people were coming for treatment to India because of the cost factor, because of the good healthcare facilities in the private and corporate sector, which will continue to see a downtrend, at least in a short term. And these medical tourists, they were also coming for our Ayush and Ayurveda system to Kerala and other places. And what is also important, which in this COVID has been increased use of technology, telemedicine, training of primary health care, mobile apps, for which even the guidelines were issued by the Niti Aayog for senior, not only for the doctors, but also some of the paramedics and other personnel who were involved in the thing. And many indigenous approaches were also found to come across because of the shortage of the beds, like converting train coaches into isolation wards in Delhi and some states, which was again an innovation. And let me tell you, we have some legal framework in our country besides the International Health Regulation 2005, which is called IHR, International Health Regulation, which is important, is to prevent, protect against, control, and public health response to the international spread of diseases, and to avoid unnecessary interference with international traffic and trade. This is a very important regulation of which we are also, our country is also signatory. Besides, we are signatories of Biological Weapon Convention 1975, which provides prohibition of development, producing, and stockpiling of bacteriological, biological material for weapons and destruction. And also we have the old Epidemic Act, which is still 1897, which is there, which has been used even in this pandemic. We have the Disaster Management Act 2005, which is in full use by not only by the national level, National Executive Committee chairman, which is being exercised by the Home Secretary of India, but also in the states. All the lockdowns, regulations, SOPs are being managed through this Disaster Management Act. Another is knowing the need for public health emergency. We have also, the Ministry of Health has drafted a public health emergency bill, which is for prevention and control and management of epidemics, biological disasters, bioterrorism, and other disasters. This is under the active consideration of Parliament, and we hope this will also be passed soon. And also, besides, there are biomedical waste, because even in this coronavirus, patients in hospitals, you need to take care of waste, whatever is coming, whether these are the PPE, whether these are the syringes, disposable needles. You have to take care of we don't want them to spread COVID. Then there are pollution, air pollution control, protection, environment protection. There are IPCs, and besides the Ministry of Health at national level, besides National Disaster Management Authority, we have the National Crisis Management Committee, which is headed by the Cabinet Secretary, with all the secretaries who take decisions with regard to the COVID-19 from time to time. We have the Department of Health Research, whose job is to ensure not only the testing, ICM, that is Indian Council of Medical Research, but also improve the number of tests, have the innovative, do the serosurveillance, and give the results, so that it helps the Ministry of Health and other response, whether it is the Director General of Health or in the states governments. The Ministry of Health is the nodal ministry for the biological disasters, and Ministry of Health has National Institute of Center for Communicable Disasters, and also the Ministry of Health frames the rules and regulations. They give the technical support for capacity development, which they have been doing in this pandemic also, to various states. What should be done, what should be the treatment protocols, what should be the advice to the health workers. At the state level, health is a state subject which has to be done by the states, and the state disaster managements along with the Directorate of Health Services, IDSP, medical colleges, universities have to work together. And there are other agencies in All India, Indian Council of Agriculture Research, DRDO, Defense Research and Development Establishment, CSIR, Central Council of Scientific and Industrial Research, Public Health Foundation of India, non-government organizations, Red Cross, universities, all have role to play. In addition to the United Nations organizations like UNICEF, Interpol, we say. And if we talk, how do we, mitigate the impact? Because the previous outbreaks have revealed that during a crisis, people with treatable conditions should not die due to lack of care, because it has been seen in many countries that the all-cause mortality has increased during the COVID pandemic. So it is important that people with chronic health conditions, what I mentioned, hypertension, cardiovascular diseases, they are at greater risk, and if they fall ill, they can face fatal consequences if infected. So for these reasons, we need to take care of these, and importance is that we not only taking care of it, but sharing of data of public health importance is very important. Unfortunately, there has been problem in many countries with regard to sharing of data of public health importance among various stakeholders. It's not only the doctors or medical, but all other stakeholders, including the educational institution. So what is required is a good planning. What we can do a short-term planning for 2 years, we can do for medium for 5 years, or long-term planning as per the Sendai framework by 2030. And we should be able to develop a clearly defined interagency emergency plans with roles and information flow clearly marked out what is required to be done for not only for immediate outbreak response, for which contact tracing, testing, surveillance is very important, but also important providing quality medical care. It's not only that you admit the patient for isolation, but if he has problem, you have to ensure quality medical care. We need to have our strengthening of our existing institutional framework and integration of the activities of all the actors, whether it is a state governments, state disaster management authorities, district disaster management authorities, and other stakeholders for implementation, where roles and responsibility of, I say, universities, both health universities, medical colleges, other educational universities is very important. We need to ensure and enhance our multi-hazard disaster preparedness efforts. Besides, strengthen our health system preparedness, make our health system resilient, not only structurally, non-structurally, functionally, and we have to be proactive, reduce the vulnerability. We should be specifically planned to protect older people, prioritize integrated disaster risk measures, protect. The important is protect first responders and frontline workers. If you don't protect them, they are going to face problems and hamper the response. And also, what is important is use remote assessment and community feedback to determine what are the humanitarian needs, which are very important. And what is also important is, besides the protection, not by way of personal protection equipment, but is the provision of psychosocial care to not only to responders, but even to the people, to the families where the COVID patients have there. And also we need to train volunteers from universities, volunteers from technical and educational institutions, because you don't need psychologists and psychiatrists for providing psychosocial care. With some good modules, this can be done even by volunteers from university students in various. So if we plan a short-term plan, that means regulatory framework, we see what has been our existing rules, regulations, how effectively we have been able to use. Have there been any problem for better implementation? Whether our integrated surveillance system, what we call is IDSP integrated, it has been, to my knowledge, it has not been that strong. So we need to have strengthening of integrated surveillance system in our country. And what is important is coordination between public health, medical care, intelligence agencies, and other stakeholders to deal with this emergencies and the secondary effects of this COVID emergency. And what is important is organizational preparedness. All organizations, whether it is our industries, whether it is our universities, whether it is our technical universities, whether it is our all business houses, they need to be prepared. They need to have their plans in place. They need to have plans for business continuity. Our educational university and colleges preparedness. And what should be, this pandemic has shown the approaches. What is our approach for online and offline approach? We have to develop the systems. We have to do the research. What has been good, what can be effective in if there is such a thing in future. We need to develop scenarios in our universities. And besides doing the research, which may be short term or long term, linking the topics with COVID, we have to find what happened in these quarantine centers. This research can be done in the universities. What was the the supply chain of essential things? It's a sort of a research can be done by the universities, and this can be done by if we develop a good university network, which is important, not only regional sharing but also global sharing of universities. And what also is important is community-based approach for self-reliance. That is, we have to ask people to prepare yourself, and it is only if we are prepared very well, we identify infrastructure and make plans. You see, if we have shortage of beds, what has been coming in the media in Delhi, if we have plans for future, we can develop 1,000 or say 10,000 beds in our using stadium, using vacant places. We need to have that sort of plans. Besides, we need to have plans for equipping first medical responders of materials, upgradation of hospitals, communication and networking system with appropriate, not only within hospital, but interlinkages with state ambulances and transport services. You may not have enough of ambulances, but you need to have alternative transport services systems in place. You have to have mobile telehealth services, and besides laying down what should be provided minimum standards of good water, food, shelter, if we have to do the administrative quarantine, good hygiene. In villages, in some of the states, there was that the sanitation was not good. So if this a sort of research is done and a good paper is prepared by universities, this can lay down the minimum standards for future. Besides the partnering local institutions with local institutions, we need to have stockpiling of essential medical supplies for future, and establishing decontamination centers if we have to take care of the chemical biological emergencies in future. And what is important is capacity development, knowledge management, where the role of public, private, and corporate sector and their participation has to be ensured. We need to develop HRD, strengthening of National Disaster Response Force, medical responders, and also medical responders can be, again, what we have been telling, that first responders, even the university students in many countries are trained for basic life support, first aid. They have knowledge of common biological and common diseases which lead to outbreak and they lead to epidemics. So we need to have a development of a human resource for monitoring and management of delayed effects of biological disasters in the areas of not only mental health and psychosocial care, but also in education and training to various categories of people. We need to have our educational curricula to be, whether changed or augmented, improved for good knowledge management, proper education and training of personals, networking, making the information with regard to the networking systems, conducting what we call CME, continuing medical education, which can be done by programs, workshops, and also we have to make our community prepared, what they should do, what they should not do, and what should be the role of community as a part of community disaster management plan. In fact, every village should have a plan, every ward in urban areas should have a plan that in case of an emergency, whether it's a natural disaster, whether it's a biological disaster, what they should do. And what is important is how do we upgrade our biosafety laboratory? The biggest problem in this crisis is the limited number of laboratories in the country for undertaking the tests, because it is the question of how safe are our laboratories for conducting this test. That is the biosafety level, which needs to be upgraded so that we have enough number of laboratories in almost all the states who can undertake tests of various biological disasters from time to time without causing problem to the handlers of laboratory material. And what is important in scientific and technical institutions for applied research and training, post-disaster phase medical document. We do a lot of work in response, but unfortunately, if you see in our past epidemics or outbreaks, documentation is very poor. We need to develop a system of good documentation, conduct surveys, epidemiological surveys, regular updating, adapting activities in this R&D mode, research and development mode, and also do the pilot studies. These pilot studies should not only be the medical, that what happened to the hospital, but also this can be done by the university in various aspects along with the health sector people. And what we have learned lessons that digital health has been able to help, and 2020 may turn out to be a decade when digital technology reshapes not only the health system but even other system, educational system, where education had to be given through using the digital technology. And during the outbreak, this telemedicine was even used for training of not only mental health, but even in some states providing training to other health workers. And what is also important is public-private partnership in the digital response with the digital technology. Health sector doesn't have the technology support. It is only the universities, technical institutions who can provide such support to not only to the important responders, but also to the important management system, whether it is in the government or even in the private sector. So we need to have, besides institutional emergency medical response, capacity development, we have mentioned, what is important is you need to strengthen the scientific and technical institutions. You see, when we say that they should do research, but we need to strengthen them to conduct the research, to undertake the research. For that, they may need budgetary support, they may need support from either from UGC, they may need from HRD Ministry, Health Ministry, ICMR, all for doing the support. So our idea should be that we should be able to develop community resilience, and we should test various elements of these plans which we make through not only through exercises but mock drills. And we have seen large number of research gaps which needs to be addressed for the response of COVID. What has actually happened in the course? We need to undertake research, analysis of whether it's the quarantine strategies, whether they were good or bad, how effective they were, what was the social acceptability, and what was the point of care, diagnostic tests, what were the best ways to apply knowledge about infection prevention control strategies, and support standardized best evidence-based approach for not only management, also models of vaccine and therapeutic vaccine research which is going on in number of countries. And again, I have said that establishment of national stockpile of vaccine when it comes is very important. And along with the vaccines, I would also say what is important is antidotes. We have large number of what we call major accident hazard industries manufacturing chemicals in all over, spread all over the states, mostly in Gujarat, Tamil Nadu, Andhra, where the accidents do occur. But unfortunately, like in Bhopal, what happened, the doctors were not knowing, they had no knowledge how to treat, what is the antidote. So we need to have an inventory of antidotes, what is required, which can be done by good training programs in the areas of emergency medicine, biological disaster management, hospital administration, specialists, nurses. And again, we need to make our hospital prepared, for which hospitals have to have a mechanism to provide a good disaster management plan for biological disasters, identified what is the supply chain, inventory management of drugs, equipment, consumables, because we want a safe hospital which is structurally, non-structurally, and functionally sound to maintain continuous operation. As we have seen, hospitals during disasters have become victims of the disasters, whether in natural disasters or even in the biological disasters. What we have seen in many hospitals in Bombay, Wockhardt Hospital, even the KEM hospital, number of hospitals became victims of biological because unfortunately we had no plan. So why hospitals become the casualty of disasters? Because again, I mentioned it's a chronically weak health system, under investment in the health. It may be the location of the hospitals may be low, no emergency plan, staff are not trained, which is a reality, and we need to be prepared in full capacity to make the hospital function so that it should not collapse. The people should be able to work, and they should be able to protect not only the lives of the patients who are in the isolation for COVID, but for other diseases as well. And it's not only the buildings, patients, but also the equipment which should be important for resilience, which should be safe, whether it's a functional element, people working, because hospitals have the social impact. A safe hospital, in these COVID patients, those who are critically, they feel, they have in their mind that if we reach to the hospital, we'll be saved, we will live, otherwise we'll die. So if we lose a hospital, you can see what can be. The disaster resilient hospital must be able to protect the lives of patients of COVID-19 and other biological disasters. And it's not only the health important impact, but also it's an economic impact, which is very important. If we lose the functionality of a hospital, it is going to create a lot of problems. So how do we get prepared in hospitals? Again, if we follow the disaster management cycle, if we are very well prepared, we'll respond well, we'll recover well, and our mitigation efforts will be good. And so we need to have an all hazard approach for multi-sectorial planning. It's not only the medical. I again say it is when we talk about public health means medical, non-medical, and there have to be resourcing, matching resources for all sectors, immediate, medium, and long term. And what works well is advanced planning, advanced capacity building or training, early warning, public education, advanced stockpiling, and leadership. What is important is leadership at all levels, transparency, documentation, well-designed plans. And if you have plans, you should not keep them in Almira, but you have to test those SOP protocols, plans by simulations, mock drills, exercises, and so that you have all the ways. Even if you have to evacuate hospitals, you have to evacuate hospitals in COVID-19 in Bombay. So where you will take the patients, you need to have the proper signage, you need to have to display, you have to have people uh, trained, and even God forbid there's a fire suddenly in a hospital in the present circumstances. Unless you have plan, you need to take. So there are functional indicators, what we call for, which have to be taken care, whether it is a medical gas, electrical system, and role of university and professional institution is very important. They have to develop professional curricula, modules of courses, and they have to act as the repositories of specialized expertise in research of all. It's not only the medical research. They should publish articles of scientific and technical publications in journals. They should contribute to the development of periodic review of national building standards, which is very important. And what we call is that in the present crisis, relocatable hospitals, which China did, shorter period of construction, flexibility of design, easy for construction, standalone. These are the pre-engineered buildings which may have to be used for our future emergencies, which we need to think. We need to have modular hospitals which can be taken from one place to other place quickly, so that in case we need more beds, we can establish these hospitals. Even containerized hospitals in many countries have used, even in the New York. And what is important is also is the emergency mobile field hospitals, which can be immediately and quickly established, 100 bed, 200 bed, 300 bed in various. And I will say the most costly hospital is the one that fails. And what is important is you cannot handle it alone. You have to build partnership among various. And let me again reiterate, public health in emergencies is a job of not only medical, but of all actors, medical, non-medical. Thank you very much.
Sangeeta?
Thank you very much, sir, and thank you for giving your valuable insight and such a comprehensive presentation on disaster management you have given, sharing your views on the disaster management scenario in India, going to status of India internationally in terms of risk by these disasters. And you also shared the in-depth the information regarding biological disaster, for which countries need to be prepared all the time and what all steps they are supposed to take. So it's time for the question answer session. And from your comprehensive presentation, I can see that whatever questions have been asked in the chat box, most of you have been answered by you in your presentation. So I would request first our esteemed members to ask some of the questions if they have any question in their mind. And I would request our Honorable Chancellor, sir, first to put his question in front of you, sir.
Thank you, Sangeeta. Really, Dr. Ahmed, it was really a very comprehensive presentation, and I think it started with the general overview and then specific on the current situation. I think you mentioned about the sustainable goals also, and I think I was reading somewhere that Global Advocacy Group has nicknamed this year 2020 as a super year for sustainability and a year of strengthening global action to accelerate the transformations, achieve the 2030 agenda. So, but with this COVID-19 happening, don't you think that this 2020 is the year for both now dealing with COVID and indirectly getting closer to our actions required for achieving the SDGs?
Yeah, you're right. You know, this COVID-19 has given us now the challenge, and that how quickly we can, if we see whether our Sendai framework priorities or even SDG, as compared to some of the countries, we were lagging behind. But this COVID-19 challenge. It has given us a challenge, and it has given a push. You know, any disaster, natural, or it not only gives us chance to build better, to be better, you know, in a shorter time. It has given us a challenge, and I think it has given us a push to meet the SDGs in a shorter time, maybe earlier than 30.
That's it. Thank you.
Thank you, sir, for explaining it so simply. Next, I would request our MD MREI, Sanjay sir, to please put up his question in front of Ahmed sir.
Dr. Ahmed, thank you for such a comprehensive, elaborate presentation. And like your presentation, I have a little elaborate question too. And the question is, looking into the environmental emergencies, coronavirus pandemic impact on business, economics, education sector, and corporate system, it is not being discussed for business to have framework for disaster management plan. We have a framework for disaster management plan too, and it should be made compulsory for business and sector like ours. What principles should be kept in mind? And looking at your presentation, you talked about 6-7 key pointers, especially on organizational preparedness, education, universities preparedness, especially on online and offline networking, capacity development. As a matter of fact, as the university, we are doing all these things. Could you give us any specific takeaway for our faculty members and many of listeners who are listening to your this?
If you go through the functions of NDMA, one of the points is the functions of NDMA is that to approve the national disaster management plans of all ministries, that is including the Ministry of Education, Ministry of Commerce, Ministry of Industries, and the Ministry of Environment and Forest, Ministry, take all the Ministry of Corporate Sector. And the idea was, when the act was made, that all the ministries will prepare a plan for disaster preparedness, which will have all the disasters, including the biological disasters, where the Ministry of Commerce and Ministry of Corporate Affairs, Ministry of Industries, they were supposed to make the business continuity plans. You see, business continuity plan is an important aspect, which has also been rather discussed in length in Sendai framework. If we go to the document, I can give you the link, and if you go, how the business continuity plan of countries should be framed so that if there is no economic problems during the either lockdown or any other disaster.
On organizational preparedness, what would be your few tips to us as a university?
Yeah, absolutely. You see, what first is whether the industries or the business houses have made their business continue, how they are going to have during disasters. One, even all, number of industries. I'll go to your question also. That is important. If they have a good disaster management plan, including the business continuity plan, the things won't go bad. But as far as the organization like educational institutions and a Department of Education, both in the public and the private sector, is important. The plan has to be, we'll have to now seriously think that how do we continue education? How do we make education should not suffer at a school level? Today, I was, in fact, I had a meeting with the Commissioner Principal Secretary of Education of one of the state, and he was telling that the teachers are idle. We have not been able to, for the last 3 months, 3.5 months, teachers have no education. I have been he was asking my advice that there should be masks, there should be sanitizer, and how we can provide, because when we talk about digital online education in many schools, especially in rural areas, people don't have avenues to to laptops or computers. So how will you provide education, online education to them? And also there's a problem of connectivity. So you need to have a plan. Similarly, in the universities, and you have technical education, you have to think, you have to knowing what has. That's what we say. The research priorities have to form. One of the research in universities, how the universities responded to the crisis with regard to the education. Where there any educational continuity in any of the university, you can share. The universities can share what were the ways and methods to keep the research going on. If there were some PhD scholars, what they were doing, were they in home, or they were doing something even at home? Were they accessible to the data? Were they accessible to the online libraries? Were they to data literature? This sort of research will be required, so that it gives you a view what is required to be done when you make a further plan, how you can respond to a situation like COVID in future.
Thank you.
So what I will advise you, one, not only if you some research is undertaken, one, and even we say the research even in these isolation centers, research in whether in some of the quarantine, what was the human behavioral research, it can be done so that it can be rectified, it can be given to the government. But look, this is what we have found in the research, so that in future this should not happen. Similarly, in the universities, if you make a good plan that how universities acted during this period, and what were the shortcomings, what were the positive things which they could do, that they put in a plan that will help in the future. And what is important is sharing of data. If you have sharing of data from various universities, both globally and nationally, you can learn a lot.
Thank you. Sangeeta ji, over to you.
Thank you very much, sir. Thank you, sir. And the last question I request Bhatt sir, though he has sent his question in the chat box, but I would request him to ask himself to the Ahmed sir.
Thank you. Thanks for the presentation. It was absolutely exhaustive, and even the minutest things were discussed there. See, which we have seen in this period of COVID, in fact, it has devastated people, it has devastated countries, both in terms of, one was the economic aspect, which Dr. Sanjay was talking about. Psychologically, if you look at it, it has really had a great effect on people. Now, with all the framework which you talked about in place, right from 1897 and onwards, we have several things in place, yet we have not been able to really come up to the expectations of people as far as medical services or healthcare is concerned. I think most of the people, and in fact, when you look at what is happening around, we have been spending so less in healthcare, which is one of the most essential aspects. We have priority. I'm not saying that it's not a priority and we should not do it. I think it is good. We are sending unmanned craft to the moon and Mars and spending so much money. The healthcare, which is primary, all those things are secondary actually. We have not really gone beyond 1%, which shows that probably health has not been a major concern for us. Why so? See, we had shortage of masks, we had shortage of ventilators, we had shortage of everything actually. And now we are awaiting. Yes, there is an awakening call. We are now getting concerned about it. But why this was not happening earlier? Actually, see, if we consider that the frameworks are there, medical councils are looking after this. The National Management Disaster Management Council is looking after this. Why do we lack so many?
It's a good question, but sir, one is, should I answer your question?
Please, please.
Yeah, Arif. You see, it's a right thing, it's a correct thing that the investment in the health sector has been minimal. India has a weakest, rather very weak public health system in our country, and almost in all states. It has been because of whatever the reason, the government priority was not given onto the health sector as compared to the agriculture, other sectors, which was also essential. So with the result that the development of health sector in states, health sector also being the state subject, could not take place, it could not keep pace with the development of like other sectors. With the result, even in the normal times, in public, you have seen in the public healthcare institutions, there were a lot of problems, which is the reality. The people getting a lot of time for even for getting the dates for surgery of their cholecystectomy, gallbladders, even for emergency care. We have a large number of patients with chronic renal failure who need weekly or twice weekly renal dialysis. There are no renal dialysis machines available in the government sector, and in private sector, corporate sector, the cost is so high, the poor man cannot afford. Even the middle class people, it becomes very expensive for them. There has been a problem in the development of health sector, especially not only the infrastructure. Other, you mentioned about the ventilators. It's a known fact that good hospitals, ICU, if we have a 20, 30 bedded ICU, 40 bedded, you have 2 ventilators, 3 ventilators. And in a situation like COVID, you had to ventilate almost 50, 60, even hundreds of patients at a time. We lost many patients because of maybe due to non-availability, due to our weak health system, due to our structure, and also we had not our ministries and our both in the government and private sector, disaster management was not taken seriously. It was taken seriously by the government, but other stakeholders, they were not taking it. Let me tell you, there's a national guideline on biological disasters, which we issued in NDMA as way back as 2008, which is available on the net of the website of the NDMA. But I'm sure nobody in the states must have looked even, they must not have even read that. They must not have read that. They took it as a document, kept it in Almira. Whereas it had everything, what is required to be done in case of a biological disaster. Whether what we have been facing now from the media gives the reports about the dead body, how the dead bodies have been, whether there's a waiting time for crematorium or other things. Everything is mentioned, management of dead bodies, where there's a dispute of dead bodies, everything. But taking disaster risk, what we call is a disaster management, we have changed now. The UN has changed disaster risk reduction. How do we reduce the risk of disasters and emergencies? We need to take it seriously at national level and at state level. This COVID pandemic has given us a challenge. People were not knowing even what is the lockdown. There were only a couple of, in fact, in H1N1 influenza, there were only 2 centers for testing of virus. One was NIV Pune and another was Center for Disease Control in Delhi, 2 centers. But then slowly they said no private sectors, unless you see private sector, as you know, making the laboratory biosafety level, you need to spend money, and you have to support private sector also, giving them some incentives, because then only, otherwise poor man cannot get test. You see the test costs of it's almost 4,500 rupees, and if a common man wants to do it in privately, he may not, especially when there is an economic problem, he may not be able to afford it. So we have to find out this COVID has given us. So we have to find out the lessons which we learned, and so how we overcome the problems and deficiencies, and make our hospitals, our systems, our health systems resilient. We need to make them resilient for emergencies and disasters. We need to think about disaster risk reduction in a serious way, both for natural as well as for man-made disasters, and make plans all, and universities, education, everyone has, even our domestic, like in US, although they have their even the plans for domestic, even for pets. If you have a pet at your home, you have to think how you are going to save him during emergency and disaster.
We'll discuss it later, maybe. Yes, Sangeeta.
Yeah, thank you, sir, very much for enlightening us, and very rightly said that any disaster has both immediate and long-term impacts, and there are so many lessons to be learned from every phase of it, and we all are learning our lessons through this COVID-19 that we are experiencing. So moving on further, let me have the honor of introducing Professor Sanjay Srivastava, who's Vice Chancellor MRIRS and MD MREI. Professor Srivastava is an expert in organizational behavior. In his distinguished career of over 2 decades, he has made a mark as an institution builder, an acclaimed teacher, a prolific speaker, an avid researcher, a consultant, and organizational coach. Professor Srivastava has worked with Haryana Institute of Public Administration for several years and was responsible for conducting programs for the civil servants as well as conducting programs for Department of Personnel and Training, Government of India at their various academies. Prior to joining Rachna, Professor Srivastava was with MIT University, and he played a key role in setting up various campuses of MIT at 17 different locations in country and abroad. He has been awarded with Honorary International Research Fellow by Lahti University of Applied Sciences, Finland, and this rare honor was bestowed upon him by the Honorable Prime Minister of Finland in February 2016. May I request Professor Sanjay Srivastava, Vice Chancellor MRIRS, to give his concluding remarks and vote of thanks. Sir, please.
Professor Ahmed, in management parlance, what we say that it is better to prevent and prepare than to repent and repair. And unfortunately, what we have witnessed in these few months, that our approach is more reactive rather than proactive. But when we are talking about our Manav Rachna Center for Peace and Sustainability, it is the Herculean effort of the team under the leadership of Professor Bhatt, under the able sustained patronage of our Honorable Chancellor Dr. Prashant Bhalla, to get some of the best minds to sit on this platform and listen to their views about their areas of expertise. Our founder dreamed that when we dream alone, it remains a dream, but when we dream together, it becomes a reality. Thank you so very much for adding immense value in each one of us. You have given a very comprehensive, thorough presentation in the area of biological disaster management post-COVID-19. And I have prepared 4 or 5 questions to present before you, but you have almost answered everything without asking, what our colleague Dr. Sangeeta Banga also mentioned. We have many professors from the different areas of the university. They have heard you, and they all have immense appreciation for your talk. And I'm sure that when things become normal, you will find time to visit our campus. Thank you so very much for adding immense value. And I'm sure in times to come, you will come one day and talk physically to all of us. Thank you.
Thanks.
Thank you, sir.
Thank you, sir. Thank you, everyone.
Thank you. Thank you.
Thank you.
Thank you.